I first became involved in global health back in the late 90s when I substituted for a colleague who couldn't go to a conference in Zimbabwe. And I ended up spending about 2 weeks in Harare in Zimbabwe doing clinical care, mostly HIV care, and teaching at the conference. And one of the first things I recognized was that there was a great divide between what we knew about HIV and what they knew about HIV and what they thought about the cause of HIV was. So we started having collaborations with them, both in terms of clinical care and research collaborations. That led to other projects, mostly HIV related, in China and in Vietnam and Ethiopia. Again, a combination of teaching, passing on expertise, and providing clinical care and mentoring. And this led to other projects where, in fact, we tried to incorporate young doctors and residents so that they also could get some experience in this area, with the idea that they either might want to make this part of their career choices, or at least they would understand how fortunate they are to work in the United States in a situation that most doctors have no ability to work in. And it led to involvement with electives in Uganda and other places where pediatric residents could go, see what other people are experiencing, get some of that experience, hopefully bring some of that back, and at the same time impart some of their expertise that they have in areas of pediatrics. So I'll give you two examples of two of the projects I'm involved in. One is to provide mentoring and oversight for HIV care in Ethiopia and in Vietnam. And just to give you some background, both of these countries received their antiretroviral drugs really with no training at all, and were expected to manage the drugs, their side effects, and the patients all at once without really having any backup. So we go to Vietnam once every 3 months, one of us does. We go over the care of all the children who are receiving antiretrovirals, make suggestions about how to use the drugs. We teach, bring people up to date on whatever the new findings are. And then when we're not there, we continue correspondence by email or by telephone to handle any emergency projects that come up. Another country I work in is in Zimbabwe, and there we have a number of projects. One is to try to keep Zimbabwean researchers in the country by providing a small monthly stipend so that they don't have to leave the country and work somewhere else. So we're setting up a state-of-the-art HIV conference for care of pediatric HIV-infected patients. We'll do a week-long seminar, feel out which of the researchers are interested in the project, help them set up research projects, and then mentor them along the way. So what advice would I give to someone who's considering doing a global health elective? I think you need to think really carefully about what you hope to gain out of this experience. If this is sort of just an example of a case where you want to visit a foreign country and see things that you're normally not going to see in your own hospital, don't do it. Stay home, write a check, and you'll do much more good that way. If you really sort of want to experience what other people are doing and see what kind of conditions they work with the idea that that would help you focus either on an underserved population here in the United States, or potentially consider either working or investigating situations in other countries, then I think that's a worthwhile thing to do. But remember, the most important thing is to become the best pediatrician you can, so you really have something to offer in your country or to the country you're visiting.